Star City News and Weather attended the grand opening and homecoming of the new state-of-the-art Eula Hall Health Center. Community members, local leaders, and civic organizations were invited for a dine-in and tour of the new facility.
Well, this is a story that began over 50 years ago with Eula Hall. Eula Hall seen a need in her community. It was a need for care amongst her neighbors, her family, health care that wasn't accessible. So she started out on that venture, and she was able to pull off through a series of steps. In 1984, the facility next door. That facility, built in a floodplain, has flooded several times since 1984. And you know the effects of flooding on facilities. And we have talked about it for a long time that we need to build a new clinic at Mud Creek in her honor.
I don't know if I can really put it into words. If you work along someone like Eula Hall and you see what all they've done and how big of an impact that her life was on everyone, even people like me, even people, just anybody. She treated them all with the utmost respect. She treated them like they were family. And to see her dream come to fruition is almost like a dream come true for me in a sense. Working as the business office manager for 17 years, you have to have a passion and a desire to help people. I see it happen every day in my clinic. I see the nurses, I see the doctors, I see that front office staff, I see the pharmacy, I see the behavioral health therapists, I see the x-ray techs, the lab workers, the IT people that make it happen, all the way from the top to the bottom, the people at our central office. It's like a close-knit family.
I started working here at this clinic about 6 years ago in August of 2019. Prior to that, I worked in a clinic nearby. One of the most important things with a federally qualified health center, specifically like the Eula Hall Health Center, the purpose is to try to provide comprehensive services for the community despite their ability to pay. So our job is to improve access to health care regardless of a patient's ability to pay. No matter what, we're going to be here for them if they have issues with insurance, or if they have difficulty with paying. They can go on a sliding scale fee that makes our services available to everybody. Every day I encounter patients that are having difficulty accessing medications. So we have a system in our clinic where I can communicate with the pharmacist quickly, ask for medications that may be similar to that are available. Maybe there's a different medication in the class that is affordable compared to the one that I'm trying to get, and they kind of help me work through that process. Our pharmacy is a wonderful part of our clinic. Our pharmacy has access to special programs where we can get expensive medications at a reduced rate. That was probably one of the biggest differences that I noticed when I came to this clinic. There were medications that I had no access to before, but once I started working for the Eula Hall Health Center, I felt like there was a whole new world that was opened up for my patients. There's a lot of brand new expensive medications that come out that make it onto our special program that we now have access to. And it's the most important thing is that our patients are benefiting from this. Patients that I have had for years now have access to medications that they previously didn't have access to.
Of course, she worked until 2021 at the age of 93. You can go Google her and see all the history about her legacy. We know that internally. We live that spirit every day. Our mission throughout Big Sandy Healthcare kind of stands upon her foundation. Everything she done was for the people. She spoke words into action. And that's what we've tried to carry on here today. It's not me, not I, not one person. It's been a whole group of people. Approximately 350 people work for Big Sandy, and all of us carry on the responsibility to keep her spirit alive.